I'm going to first, I'd like to thank Dr. Baker and the folks from the Arizona Coalition for Military Families and all the other folks who behind the scenes really put in the effort to pull this together. This is the first of its kind. So I'm really pleased to be here and be a part of this, especially as we wrap up PTSD Awareness Month. So that's part of the reason for the timing of this anyway, is that we're right at the end of the month. And so part of what I'd really like to share with y'all today at the end here are some take-home messages to help us all become more aware, not just of PTSD, but also of the resources available for people diagnosed with PTSD, and also to carry that message onward and share with others. So that's where we'll end today. So wow, just a tremendous number of breakouts, and I hope people were able to pop into the ones that they were really interested in. Dr. Wirtz presenting on how to explain PTSD to children of different ages. So important, as veterans are often members of a family, and we've heard about how, you know, PTSD and symptoms related to trauma affect not just the individual, but everyone in the family potentially. So important topic. Dr. Bushnell presenting on concussion, TBI, causes and symptoms, as well as, I love this part, how we can take care of our brains throughout our life. I think that's super important. So I hope that was helpful to folks. Dr. Sigler talking about moral injury. Again, different in some ways from what we traditionally think about when we're talking about PTSD, but very often, at least in my experience, is the reason that people land in my office. Super difficult experiences. And so the good news is, again, we have treatments and strategies that help with moral injury. So then Mr. Godwin provided, again, an overview, also talking about effective treatments for PTSD and information for family members, including the all-important coping strategies, right? That's kind of what we're about. So again, just a reminder, these sessions have been recorded. So if you were only able to watch one, pop in on one, then the others will be there available in recorded form. Dylan Richard presented on how intimacy can be affected by trauma and symptoms of PTSD, right? So again, thinking beyond just the kind of typical, you know, I have nightmares, I have this, I have that, but really expanding our scope and talking about how these experiences can affect so much, so many aspects of people's lives, intimacy being an important one. And finally, Dr. Charlson gave an overview of post-traumatic growth as one positive change that can result from traumatic experiences, as well as possibly some conditions that might foster post-traumatic growth. I have been, actually right before this session, I was working with a veteran and we're talking about post-traumatic growth. So, I mean, it's a really important experience to notice for people, because I think we can overlook and become focused on symptoms and how it's affecting functioning and sort of that pathological focus, and forget about post-traumatic growth, but it's very vital and very important. So again, terrific presentations this morning, and thank you to everyone who was able to participate and all the folks who made this happen behind the scenes. So I'm Dr. Sandra Gallagher. I'm a psychologist in Tucson, graduated U of A, go Cats. And I've been here since 2008, worked also in the Tucson community and community behavioral health before that. So started my career here in co-occurring substance use disorder and PTSD treatment, learned a whole lot, and have really felt privileged over the years to work with veterans in their recovery. I came to the VA, actually I trained in the VA as an intern, loved it, loved the experience, but really came to VA more importantly because 7 of the men in my family, six uncles and my dad. We're all veterans from every branch, so no favorites. And so military service was a part of our family culture, part of our values. And the VA in itself was a part of my life forever, because my dad got his care at a VA. And so it was always about the VA. So I've been really privileged to come back and work at a VA. And that's the reason why I do what I do. So with that, I will turn it over to either Dr. Ludke or Stacy, whoever wants to go first.
I can go ahead. So I'm Dr. Brainy Ludke. I'm a clinical psychologist and the program manager of the PTSD clinic at the Phoenix VA. I'm also a national trainer and consultant for a couples-based PTSD treatment, and engage in some research looking at just developments of new treatments and trying to see what's kind of the most effective treatments out there for our veterans. I've been with the VA my entire career thus far. So I actually entered the VA as a practicum student in Indianapolis. I had interest in working with schizophrenia and psychotic disorders. And there was a pretty well-known researcher and clinician at the Indianapolis VA that specialized in schizophrenia. So I spent 2 years there, and then I did my internship at the Cincinnati VA, where they told me you have to do something other than psychotic disorders and schizophrenia. So I landed in the OEF-OIF-OND clinic at the Cincinnati VA, and I was trained in evidence-based PTSD treatment. I just really fell in love with that kind of work. So when I was looking for a job after that, a research study opened up that was blending mindfulness meditation into a couples-based PTSD treatment that was fairly new at the time. So I never thought I'd be in research in the beginning of my career, but I jumped on board because I thought it sounded like a fantastic research study, and I was really enjoying the PTSD work and thought that couples work would be really valuable as well, as you know, the impact that it has on the family system. So I did that for 4 years, and then I got tired of being freezing cold in the winters in the Midwest, and I moved out to Phoenix in it was March of 2015, and I landed a job in the PTSD clinic. And when my program manager moved up to chief of psychology, I thought that it might be a good shift too, because I was really interested in programming and again, continuing to try to develop new ways to reach out to veterans. So I've been doing that since 2015.
Hello, everyone. My name is Stacy Walsh-Hubler, and I am the PTSD clinical program manager here at the Northern Arizona VA in Prescott, Arizona. And I have been in this position for almost 2 years. Prior to that, I worked for a small rural community-based outpatient clinic in Northern California, almost to the Oregon border. And I was there for 3 years. That's how I entered working for the VA. I'm originally born and raised in Northern Michigan on Lake Michigan side. And I got my master's in social work, actually 20 years ago now, from the University of Michigan. And after graduation, I actually moved back to my hometown area, and I worked for a local nonprofit that worked with victims of crime, worked with individuals who had experienced intimate partner violence, sexual assault, sexual abuse. So that is when I started working with individuals who had PTSD. And while I was there, I became trained in eye movement desensitization reprocessing, which is EMDR for short. And I am now certified in that therapy, and I love it. It's my passion, and it gives me so much hope. And I just really am so impressed with anyone who is willing to go through that process with me. It is tough work, but it also is absolutely life-changing, and I've seen it. And so that's what keeps me going in this field, is seeing that.
So with that, What I'd like to do is I'd like to, for all of us to discuss a little bit, some questions. I'd like to just ask my fellow program managers, what services would you like to see in your clinic in the future? What do you think you'd like to see more of?
I can start. I'm off the mute button first, so. One of our goals at our clinic here is to have all of our providers trained, and ideally at least 2 evidence-based treatments, so that if one treatment doesn't work for a veteran, then we can, pull another trick out of our hat and try another evidence-based treatment. So that's something that we're really working towards. We're also trying to integrate a lot more measurement-based care. So really looking at how is somebody doing when they first come in? What are their symptoms of PTSD? What are their symptoms in the middle of treatment, which oftentimes we will see an increase in their symptomology, but then hopefully by the end of treatment, we'll see a decrease in that. So we can actually use that as a tool with our veterans too, to be like, hey, here's where you started, here's where you were, in the midst of the work, and then at the end, and they can also see their own improvements. So those are a couple of things. I also am a co-chair for the whole health committee here at the Navajix, and I really want to see a lot more whole health integrated into our treatment, really looking at the whole person. And also, I'd like to really see a lot more complementary health approaches. So really referring our veterans more to, maybe yoga, Tai Chi, making sure they're, are they getting like chiropractic care, different things like that. And also more community involvement. We had our PTSD awareness month reception here on station, and we had equine therapy come. And so that was great. So just looking at, again, the whole person and just seeing all the different places we could, plug them in.
I will second what you shared. As mentioned, we're on a lot of vision calls and national calls together. So all PCTs kind of have the same mission and goals in mind. And those are definitely areas that the Phoenix VA are working towards as well. Like I mentioned, my background in couples-based PTSD treatment, there's been a lot more research over the years about the benefits of integrating loved ones into treatment. And a lot of my staff are also trained in that particular therapy. And we really have a lot of rich conversations about, how can we get the veteran family system kind of more involved? What kind of services can we provide, again, for that kind of wraparound? How can veterans, significant others support, even if the veteran's doing individual treatment, how can the family kind of support that so that we maybe have less dropout? So we definitely like to see how we can integrate the whole family into treatment more often. I would say probably too is to continue to utilize technology to our advantage to be able to reach veterans that are maybe a little bit further out, that aren't able to make it to the Phoenix area. We were doing telemental health, for the past 10 plus years, even before the pandemic. So switching to video during the pandemic was a little bit easier shift than maybe some of the other areas of the hospital. But it really helps to reach some of the veterans that are, working, have childcare issues, just transportation issues. As much as we can reach out to accommodate the veterans, we want to try to do that as well. And kind of just like you mentioned, research or outreach. So trying to integrate more with the community. We've been working a lot with our local vet centers to see how we can coordinate care better between the 2 facilities, and just really, looking into also integrating peer support specialists into our PCT clinic. A lot of times peer supports, we all saw the guest speaker that had a lovely story about recovery. And so if we can kind of capitalize on people that have been through recovery that can help other veterans, if they're kind of on the fence about whether they want to begin treatment, what it might look like, to have those that have went through that recovery process to reach out and to try to assist with engaging people in care and also keeping them in treatment once they begin, is kind of another goal of ours at Phoenix.
Nice, thank you. As you were both speaking, I was reflecting on, I think what we're talking about here is really empowering ourselves to be as flexible as possible, to really meet people where they're at, to be able to offer all kinds of different options through the full continuum of care, right? All the way from self-directed care, such as, I mean, there's even phone apps right now that people can jump onto, try stuff on their own, self-directed care, then into peer support, then into, you know, other options for different whole health or vet centers or community programs. I mean, the whole point of what we do is to try to get help to people, but that help needs to look different for everybody, right? And so I think what we're talking about here is really being maximally flexible and understanding that we have a lot to offer. I often tell the vets that I end up working with is like, once they're in, it's like, hey man, the world is your oyster. I mean, there's so much for you at this point. It's just a matter of, I think, knowing and how to tap into all of those different resources, knowing that there's a lot out there. So I really appreciated some of those comments about that. Right, and we get the, you know, the evidence-based practices for sure. That's what we're here for at VA, all about that, right? Evidence-based practices. We know these things work, not just from the research, which is important, but also from our personal clinical experience. We've seen it. We've seen it work. You know, Stacy talked about really seeing those changes and watching and shepherding people through that. I think is awesome. Really appreciated Sven's courage to talk to us this morning and to show what it means to work through that recovery process, and to know that that is possible. So that hope is there. So that's our goal ultimately, is just to meet, who's this person in front of me? What do they need? What are they telling me they need? How can I help them best? Knowing that it's not a one size fits all. It never will be. So with that, I'd like to ask my illustrious panel participants, what is something that you've taken from your work with veterans with PTSD?
There's a lot of things I think that come to mind, but I think for me is just that resilience. Just seeing that recovery process is just really remarkable to see people work through, and to see that change that can happen in as little as, 6 to 10 weeks, So I think just taking away that, and just the immense gratitude that I remember early on in my training, working with a World War II veteran that had never shared a story before, and to be able to be trusted by someone that's never even opened up to their closest loved ones to share that story. And it's really, it's a piece of history that, I was only privy to getting to hear. So I think that's just such an honor, and, just really what makes this work so incredibly rewarding is to have people like that reach out to us, trust us, and recover.
I would say also that it's very humbling. And I'm always amazed when people actually stay in my office. I always make a joke that, I'm amazed that they don't run out the door, because it's just such tough work oftentimes, and it's making themselves vulnerable, and that they're willing to come in and work on that. And I feel like I'm always learning from our veterans, and I think they have so much to offer, just in they have a lot of really good insight into even being aware of your surroundings. And, over the years, I've had them be like, Stacy, when you walk by yourself, and just making me more mindful of safety issues and things like that. And so I just am amazed at people's ability to heal, and I feel like I'm learning every week. I'm learning something new from them. So
I really appreciated your comments. I think probably a lot of us as providers often get the question or the remark, I don't know how you do what you do. I don't know how you sit there and listen to that every day. And like, yeah, but that's not what I'm focused on, right? I'm focused on what I know is there in terms of recovery, and how can I help this person find that within themselves. You know, I love the history lessons. Dr. Ludke talked about, man, this person is a living piece of history. I love that. And some of that is the privilege of the work that we do, is to hear those stories, right? And to feel that trust that is given to us, the courage, right? To walk through the door and not run away, like Stacy said. Wonderful, tremendous privilege to do the work that we do. So, you know, I'm not focused on, you know, pathology a lot of the time, not focused on what is the, you know, the horror of what I'm hearing. I'm focused on where's the next step in the growth? Where are we headed? How can I help this person find their way? That's my focus. So again, I really appreciate your comments about what we take from this work. And with that, I'd like to ask what you think the future of PTSD treatment might look like. What it'll look like in the next few years, how it would be different from maybe what we're doing now, kind of what you see coming down the pipe.
I think what you mentioned earlier about, you know, kind of more self-directed care, there's a lot of different apps being developed. I know my mentor that developed the couples therapy for PTSD has been studying like a web-based version with couples, to where they can go and they watch clips of videos, and then the therapist kind of checks in. They have out of session practice. So it's really mostly directed by the couple, with kind of the therapist as the guide. So I can see things kind of shifting more. It's more convenient, you know, it's on the couple's time. So I can see it moving in that direction. Also, a lot of programs are looking at how can we shorten up some of the treatments and do multiple sessions a week. So there's some intensive outpatient programs that are looking at, you know, doing trauma treatment every day, or sometimes, you know, we recommend twice a week if you can work that in your schedule. That way you're not kind of taking up, say, maybe 12 weeks out of your life, but you're really just kind of hitting the ground running, and can shorten that up into maybe, you know, 4 to 6 weeks. I've also been, for the couples therapy, we've played around with condensing the treatment into a retreat format. So there's a lot of kind of early on evidence to show that that's helpful as well. So couples might do maybe 6 or 7 sessions over a weekend retreat, and then they have follow-up couples sessions to finish out the protocol. So it's kind of this idea of, you know, kind of when people are motivated, if we can catch them when they're motivated and treat it fast, we're seeing a lot of really great evidence with that. Another thing that might not be in the near future, but hopefully someday, I've been fortunate enough to, like I said, my mentor has been doing the couples therapy, and I'm currently being trained in an MDMA assisted psychotherapy. And so looking at, are there ways that we can also have larger gains in reductions in PTSD symptoms by possibly using other forms of medication. And really, yeah, that's kind of where I see some of the research going, and some of the potentials that we might see coming down the road. You hear us say evidence-based therapy is a lot. And what that really means is that, you know, the VA doesn't want to implement stuff that, you know, is kind of early on, that we don't know what the long-term effects are, or is there enough evidence to show that, you know, this is effective for all kinds of different types of trauma, all kinds of different types of individuals and ethnicities and cultural. So we really do a lot of our homework before we start implementing any of these types of treatments clinically. So I'll turn it over to you all. You can tell I'm a research nerd.
Thank you. I was actually, you touched on a couple of things that I was going to mention, and one is the condensed versions of some of the treatments that we provide. Again, you know, we do provide evidence-based treatments, so it's not just us saying, hey, we think this is a good idea and we're going to try this now. No, there's hundreds and hundreds of people who've been through trials of therapies that we deliver and in the formats that we deliver them, right? So also, you know, this video, doing therapy over video was a necessity because of COVID. But now I think we're really seeing that for some people, this is the way to go, right? I've had veterans say, yeah, it saves me gas money. Like, that's important, right? It's reducing yet another barrier to care. So I think video therapy is going to be with us. It's going to be something that will continue. We were doing it before, but then, you know, because of COVID, it went to basically 100%. So now, you know, kind of going to stay somewhere in that 50% range probably, to offer, again, maximal flexibility. That's what it's about. So yeah, so condensed versions of the therapies that we do, for sure, there's some support for that. And I would like to see it expanded as well into more systemic kinds of services. So beyond just the therapy room, right? There's a lot more to life than just the therapy room. And so kind of reaching out to people and finding other places where we can deliver these really effective treatments, and family members involving the whole system as well.
I would like to add that I just really hope that we'll continue to see a lot more support and kind of continue to break through those barriers of the stigma of PTSD. And, you know, hopefully we can continue to do more outreach and just make our communities more aware also. It would be great also if we could, you know, kind of catch some of this earlier, you know. I think of like our veterans, etc., especially our Vietnam veterans who, you know, maybe for the first time, you know, that they're finally, you know, engaging in treatment. They've been, you know, dealing with PTSD for 50 years, you know. So if we can get those messages out there sooner about, you know, the treatments and the message of hope and break through that stigma, that would be a mission of mine personally that I'd like to see. Also, I had a nurse who works in the TBI program come up to me the other day and was interested in starting specifically yoga for our veterans that have PTSD. And I was like, great. So that kind of goes back to what I said earlier, but trying to just, you know, integrate some more holistic and different approaches. So
question in the chat box from Katie in Phoenix about, do you ever receive responses for clients questioning how someone can provide PTSD therapy or treatment when they may have nowhere been near war or struggle with PTSD themselves?
Thank you. Well, absolutely. I mean, I think that that's where a lot of people are starting initially, and to acknowledge, you're right, we don't have the same experiences. That's absolutely true. What I do try to, and actually this comes up sometimes when you're working in groups as well, right? Because you'll have, you know, 5, 6, 7 human beings in a room who all have had different experiences. However, I do find that when we're working together as a group, we find common ground in our responses to the events. So not the events themselves, no, those are different. But in our responses to the events, we share those commonalities as human beings. And so we do start from that place of acknowledging, you're right, I don't have the same experiences as you. So help me understand how I can be of help to you. That's my training. So I hope that's a partial answer. Dr. Ludke or Stacy, want to chime in?
I guess I'll just second, you know, what you shared as well. And a lot of our therapies look at how someone makes sense of the event. So like Sandy said, it might not necessarily be the event itself or the details of the event, but really, you know, what are you telling yourself about the event? Do you blame yourself or someone else? That we kind of look at to see how people got stuck. And I recall, several years ago working with two veterans together in treatment. One had PTSD, one did not, but he wanted his battle buddy basically to do the couple's treatment together. So we just kind of adapted it. It wasn't an intimate partner relationship, but that was okay. So we adapted the treatment, and it was interesting because they were together during that event and saw the situation much differently, interpreted it much differently. So the one with PTSD was interpreting very much that he could have prevented it and kind of got stuck in that kind of mindset. So we worked together to kind of unravel kind of the event and talk about the kinds of areas that was keeping him stuck, and he did recover. And it was interesting though, because the same exact event being in that they had much different interpretations of what happened and who could have prevented it or what caused it.
Thank you. Yeah, that's where kind of all of these practices come from. We're trained in, more of the science aspect of it, and that's what we bring to the table. But every single person that walks through the door, right, we're going to have to meet that person where they're at, and hopefully our treatments can flex, and we find a way together to make it effective. So I think it was Stacy mentioned that her goal is to get all of her team trained in at least 2 different kinds of practices. And I think that's so valuable, because I was just talking with someone this morning about, I know all these things, and what ends up happening is sometimes we kind of MacGyver these things together. And you have to, right? You got some duct tape and you got a beer can that you cut, and you're going to do this to, make it a tool. And, it's like, that's how it works. We pull from things. That's our role as professionals. We pull from what we know, knowing that they're theoretically grounded and supported by research and evidence that says they work, to meet the person where they're at. So I appreciate that kind of a working relationship with people. So. All right, let's see. This is kind of a broad question. Is there anything you would like to share with veterans that they might not know? I would assume about PTSD or coming in for PTSD treatment. So yeah, whoever would like to take that one.
One thing that I recommend is for our veterans and their family members to go to the ptsd.va.gov website, because there you can actually learn a lot more about the evidence-based treatments, and you can actually compare to see which one might fit you best. And there's just a wealth of information on there. So in the past, when I've had to present, I actually go to that, like all my information is there to share. So really recommend that resource for people. So, and I can put that in the chat.
Yeah, and I think that we heard this with the speaker this morning, in that, recovery is possible, and that you hear us talking about many different types of treatment. And you heard him share too that, he tried a couple different avenues and found one that really worked very well for him. And I just want folks to know too that, once you come in, you sit down with a provider and you go through all of these options, and you don't have to make a decision right away. You can think about it. You can try one, and maybe you and your therapist, after 3-4 sessions, if there's no change in those symptoms, maybe you redirect to a different type of treatment. So I don't want people to think that just because they start one that they're stuck. You hear us talk about people dropping out of treatment early, because it does. Like this morning, it does get harder before it gets easier. And we would rather take a pause in a treatment and discuss the reactions and see if it's a good fit and see if we need to go a new direction, rather than, the veteran just kind of dropping off and then we worry, okay, where are they? And we call you a million times and try to get you back in the door. You can see different therapists. We really work really hard as a team to try to, again, accommodate the veterans' needs where they're at. So hopefully people, the takeaway is to stick with it, and that it is possible to recover.
Thanks. Yeah, I appreciate you put in the PTSD website, tremendous resource. Again, just talking with someone this morning, and the idea knowledge is power. right? When you know, then you can figure out what's going to work best for you. And so really getting informed about different options. We've talked about the whole continuum of care, all the way from just learning about things, which, you know, the PTSD website is a great way to do that. Phone apps, addressing whatever is important to you. For example, maybe it's a whole health type of intervention. In Tucson, we used to have, I think it was called Life Force Yoga. That's a specific type of yoga for people who've experienced trauma. So there are all kinds of different options that people can access in terms of care, all the way up to even residential programs, right? If you really wanna, you've tried outpatient, you've done different things, and you're just like, okay, I'm gonna do this, you know, 7 weeks of really intense treatment, really focused treatment. Yeah, we have the whole gamut. So it's about getting that information and really thinking about what's going to work for me. Where am I at in my journey? What do I want to accomplish? So that is definitely a good place to start. And I'll share a couple other things here toward the end as well. The other thing that I guess I would like people to know is, I find myself saying a lot, you know, these therapies that we do for PTSD, very, very effective. And they are work. They take effort. They're not kind of what you see in the movies or on TV, where you just kind of get together and chat with a nice person for an hour a week. They're a bit more than that. And again, so having that knowledge and knowing what these therapies are about, and really sitting with the decision of, is this the right thing for me? And is this the right time, right? And if it's not, just know there's other options, and a lot of them are helpful and effective. So there is hope, and things do work, and it's a matter of finding the right fit for the right moment. So with that, I think we've got one more kind of specific question here for us, and that is how can veterans get connected to care at your VA where you work?
Really, there's multiple ways. So we like to say that we have multiple doors, not just one route to getting treatment and getting connected to care. I think the number one thing is just to make sure that you're enrolled at the VA. So you can go to the eligibility office and make sure that you are established with the VA that you are choosing to go to, and they can set up an electronic medical record for you. And then, you know, it could be a primary care doctor that you see, that you mentioned, you know, having some symptoms, and they might give a warm handoff to a mental health provider in primary care to do just kind of a mini assessment, gather some background information, discuss treatment options, and they may place a consult to the PTSD clinic, which would come to us, and we'd get you scheduled for an intake appointment to discuss treatment options. Another route is sometimes people go to our general mental health clinic at the main hospital, and they do a walk-in. And they might meet with a social worker or a psychiatrist or a psychologist. And again, kind of just get some background information on what kinds of challenges that you're having, what kind of, you know, goals do you have for treatment. And they might also place a consult to our facility or our clinic to get engaged in treatment. Other times, you know, people will just call directly. Maybe they've already went through a compensation and pension exam. They know they have a PTSD diagnosis, and they're looking to get into treatment. So we can kind of just facilitate that right off of a phone call as well too. So really, it's just any provider that you see, you know, feel free to tell them and just say, you know, hey, I'd really like to talk to someone from mental health, and they will be sure to connect you. We have a very open door policy at our VA.
There are a few questions in the chat box. I just want to point out to you folks so that you can address them when you have time.
Yeah, I've been kind of seeing those pop up, and one of them is about working with homeless veterans with PTSD, multiple barriers. How can we encourage care? So again, as far as accessing care, we have a homeless, here in Tucson, the Homeless Services Clinic, and a person can just walk in. So very much like what Dr. Loki is talking about, there's no wrong door. Primary care, walk into the mental health clinic, walk into the homeless clinic. There are any number of ways that people can access care. And even if someone isn't currently enrolled for services, it's great if they are. That's a really good place to start. But even then, some of our walk-in mental health clinic, our walk-in social workers can help someone navigate eligibility and enrollment. So really, it's just kind of show up and tell someone, hey, I think I need some help. So that's the hope. There's different ways. I see a specific question about prisons and Maricopa County Jail. Those would be a little bit beyond what I would know about, but maybe Dr. Ludke can email or something that specific question. I also have a list, and I can put it into the chat as a file, of phone numbers and websites of all kinds of VA. These are national resources, so it's at least a place to start, and then drilling down to get to your local resources, right? For us, it's, show up here to the eligibility and enrollment office in building 56 or whatever, and start there. So there's many, many different ways for people to get connected with services.
I just wanted to piggyback on Brandy. I mean, we're the same process. It's either through your PAC team, general mental health, and those referrals get to us. Also, each station has a Veterans Justice Outreach worker, and they are either stationed in the mental health service line or the social work service line traditionally. And they can often help our veterans who are having issues with incarceration. Nice,
thank you. So at this point, I'll just sort of offer a few closing remarks to kind of summarize, hopefully some take-home messages for us today. First of all, I remember, how poignantly Sven talked about feeling alone in his struggles with trauma-related symptoms. And he's not alone in feeling alone. That is a thing that we hear pretty regularly. So I think it's helpful to remind ourselves that currently, today, there's about 8 million people in the United States diagnosed with PTSD. That's a lot of people. So definitely not alone in the experiences that a person might be having. Unfortunately, we also know that many of those people do not get help. They don't get connected to effective services. Lots of reasons for that. Stigma around mental health is one of them. Continues to be a big one. So hopefully, in forums like this, we can begin to undo some of that. And by sharing the information that we've shared today, each one of the 100+ participants that we've had can take this information, can take the message out to people and say, hey, did you know, right? And so one of our main goals today really was to get the word out that there are highly effective treatments for PTSD, that they reduce symptoms, and that's important. But more importantly, to me anyway, is they improve the quality of people's lives. So you have to remember the one thing about a diagnosis of PTSD, right, is that you experience a certain kind of symptoms, but they also have an impact on your ability to function in many different aspects of life. And so improving that quality of life is really kind of the end game. All VAs have trained professionals whose mission it is to serve veterans and to provide the best evidence-based treatments we have right now for PTSD. Every VA nationwide has a PTSD clinical team, and that is their purpose. That is their mission. That's my mission for each of us. That's what we do. So I would also share with you a phrase that came to mind as I was preparing kind of for this PTSD Awareness Month, which is every June. A life event doesn't have to be a life sentence. To me, that's what PTSD treatment is about. If you're interested, the national website also has this separate kind of part of the website called About Face. And on that part of the website, there are little video segments from all veterans from all service eras, all ages, genders, talking about what it was like to experience PTSD and what PTSD treatment was like and what they've experienced since, the effects of PTSD treatment on their lives. So as someone asked, you know, I'm a provider, right? That's my role, but veterans' voices very often are much more impactful. So I always tell people I'm working with, go check out About Face. It's really cool. Veteran to veteran talking about what this stuff is like. So would recommend that as well. So once again, the national website, www.ptsd.va.gov. I think as Stacy mentioned, there's also information for family members and loved ones. So just, you know, on the end of that web address /family, and that'll take you directly to those parts of the website. Super helpful. And again, there are mobile apps also through, you can access through that website as well. If you're into using your phone and you want to check out some of those ideas for self-directed care, lots of them at this point, all by the VA and all free. So those can be accessed through that website too. So I guess in summary, I would just say, remember, and please spread the word, share what you've learned today. PTSD treatment works, right? And that's what we're here for. Thank you.
Thank you so much, Dr. Gallagher. I will say we have a final question in the chat, which is, I've come across a few veterans suffering from PTSD, drug abuse, and homeless or other mental illness. And a lot of veterans don't approve of the VA. What would be a good approach to reach out to these veterans to help them connect with services, if I'm summarizing?
Yeah, so we have, and I very often talk with folks about this, there certainly are people for whom the VA is not going to be their first door, and that's okay. That's where maybe vet centers might come in, or other community services like, you know, Be Connected maybe has some other ideas for how people can get help. Yeah, the VA isn't it for everybody. Vet centers, it's really cool actually. Their history is that they were started by the Vietnam veterans who were coming back and really just did not want anything to do with the government or the VA for understandable reasons. And so the vet center has a really cool history there, and that is another option.
Wonderful, thank you. And I'd like to thank everyone who's attended, and also a special thank you to Dr. Gallagher, Dr. Ludke, and to Stacy for being here and being willing to, as program managers, step up and put yourself on the line to answer questions and to share. That's very important. Thank you all for being here. Thank you all for your questions and participation. Again, a special thank you to Sveno for sharing his story earlier this morning. And thank you all. And with that, we will close our summit. Everybody have a wonderful rest of your day.